The first item is the approval of the minutes of May 12th. May 12th. I hope you've all reviewed them. Any comments? A motion to approve. Second. Second. Any discussion? Those in favor? And I need a form. What's it for?
Any opposed?
Right. Oh,
Yeah, so there is a lot in there from me. The first thing is this larger printout. Fiscal year 22.
Very
and
good.
Fiscal year 23. It's all the data capabilities for those two fiscal years, so. I'm going forward, I'm gonna continue this. You have it all in one instead of trying to go back through the quarterly reports. What else? I did go through the first event out portfolio, and but Bay State had put on there was a state trooper there. He's based on Northampton, but he does community outreach, and he's also a first aid tech, so he is organizing an event. Part of the old ambulance building is there, so there's a driveway that goes down to Railroad Street. So there's parking in the back. We did use back there. We put a sign up on Main Street. I thought maybe have a tri-town, but we're going to have people sign up there with arrows, directing people. Yeah, hopefully get some people. We'll advertise it for everything, which is great. The instructors will be there for sign-offs, so that's another incentive to get people there for that. I've had 4 cyclospora cases in 2 weeks. A lot of invested. It's a 45-minute conversation. It's all, and that is part of this packet. I've included tick-borne and some foodborne stuff. So right now it's cyclospora and Vibrio season. Vibrio is from eating fresh raw shellfish. I did have 1 Vibrio case. That was pretty straightforward. We ate 1 raw oyster for the first time ever in his life.
That's the last
yes.
time ever in this.
Yeah. I'm like, are you ever gonna eat them again? He's like, yeah, I will. I'm like, good for you. So, but the cyclospora case is, the common denominator was blueberries from Big Y, and I think strawberries was the other leg
Oh,
out of all of them. So they're maybe not properly washing, like running water to remove it. It's a parasite, makes you very sick. People are like, oh, I have diarrhea, I'm gonna take some Imodium, it goes away. They stop taking Imodium, it comes back, so then they go to the doctor, they do a stool test. So then when I talk to them, we have to go a look back at 14 days from when their symptoms started. So it's getting those receipts from the grocery stores, or if they shopped at like Guido's, get like the last 4 digits of their credit card and ask the stores to print receipts. So that's the big thing right now. Cyclospora ends the end of August, and I think Vibrio goes through October. So I'm praying for the end of August.
Why is it red? Just because of the cycle of it.
Because it's, I guess because, farmers markets, there's more, people are going to farmers markets, maybe people aren't washing their hands. I talked to an epi after my 4th one came in, and she's thinking it's these low-lying growing fruits and vegetables and fresh herbs and leafy greens, and I think it's something that maybe lives in the soil, so. And I'm like, have any correlation to the amount of rain we had? She's like, we don't know. She's like, we had a cyclospora outbreak in 2019.
oh, wow.
So, yeah. And it's been interesting.
I don't see that on, is that here on the?
So that was for July. So that's not gonna be on this.
On that one.
Yeah, that will be for the new.
What town?
What times was it? Lee. Duffield. I don't know, I can't remember, I thought we had kind of had a little PTSD from that, yeah, I kind of locked it out.
Just not picking up.
Yeah, I don't remember.
Was there interconnections between the towns?
Yeah.
Yeah.
No, not the towns themselves, like there was no restaurants. It was basically the Driscoll blueberries and strawberries from Big Y. And there was Great Barrington and Lee Big Y, so it wasn't. That was, and I thought the first one, the person also grocery shopped at Big Y, but also went to the farmer's market in Lee, so we're thinking, oh, maybe it was the one farm that was there. So,
It's interesting that it was Driscoll's.
yeah,
I would expect it to be more the U-Picks locally, which is one of the reasons why you get a.
no, because
cutoff season.
they're able to, so then when they're like, okay, there's this common connection, then the Eppies are like, we are requesting the invoices
Right,
for this time period. So they do a deeper dive.
right.
Yep. So,
And at the local level, the stores have been cooperative.
yes,
Oh,
so I asked the cases for their shopper card for Big Y, they give that to me. I have to email this branding guy at corporate, who then follows up with a case and asks, their permission. Like it's okay, access to store receipts.
Big one.
So yeah, they've been really good.
I mean, in my experience, I've dealt with Price Choppers, Big Ys throughout the county. They actually have their own like
Yeah,
They do,
sanitarians.
yeah,
And so I've gotten multiple calls over the years on outbreaks. So the larger corporates are accommodating because they don't want to mess around. It's the small mom and pops where they
Right.
have that kind of infrastructure. In my experience, they've had trouble.
mhm. And then if, like, you go on the CDC website, there's like cyclospores everywhere, there's restaurants, and so, for whatever reason this year.
Were those from the same, were those from the same Big Y store or from several?
So Lee and Great Barrington, Big Y. It was, I think 3 of them were Lee, 1 was Great Barrington. But they're all of theirs, so I think everything is distributed out of Chicopee. So then where they get it from, from there, so they're obviously the trucks are gonna deliver. The same truck is probably delivering to both the Big Ys. So, I know Nancy had, some cases up in, her area. So I think she did like the basil or something from Vito's. So yeah.
Thank you. Sorry. to interrupt you.
Living's good.
What's up?
The other items under public health.
So, we have the flu clinic schedule set. Right now, we do not have COVID on the registration until they release what they're gonna put out. So you get the monovalent.
Will you just tag that on to this?
We
schedule?
can add that on as a vaccine, or if somebody registers only for flu and they're like, oh, I want the, we can add that on easily at the clinics, so, yeah. So, yeah.
I'm sorry to interrupt again, but I have another quick question on the flu clinics. Do you have an approximate count on students that need to be immunized before the start of school in your grouping?
I have no idea, what do you mean?
Well, we're fighting something with the state right now, and we're trying to make a point that I could tell you right now, Framingham has 3,800 kids that need to be immunized in the next 2 weeks before they can go to school. And
Immunized for what though?
for all of their school shots, preschool shots.
Oh, well, so so I was a school nurse before I, became public health, and I mean, if they're due for something, they definitely could get in to get their immunizations, but generally it's when they go for their physicals. If they're due for an immunization, they will get that then.
Oh, okay, but you don't have kids that are at risk right now for not starting. We're asking this question across the whole state.
I
Has
can
to
reach
do
out
with
to
the
the
immigrant
school
crisis.
nurses. I can reach out to the school nurses. I don't know that they're probably not working yet. But I can see if they know of anybody that. It would probably be the kindergartners that would need those immunizations before they come to school.
Right, and only because you guys have not been hit probably with the immigrant issues yet. Not
Yeah.
saying you won't be, but we're seeing it. We're trying to make a point with DPH that they need to increase some more, or go for more funding because of this. Because we have to stand up a lot of clinics, lots of kids out there across the state. Right now.
Right. I'll reach out to the school nurses and see what they say.
Thank you.
Yep.
Taking the seat of education, is the material that you've given us, that would be just, but.
Yeah, I included 2 posters. One is ticks, one is mosquitoes. I guess you could hang those up in your town hall. And then I did include chicken. Yes, there's plenty in there, but, so these are the fact sheets from the state. So when I call somebody, like, I don't have to call anybody that tests positive for Lyme, because it's just so prevalent. I reach out to providers for anaplasmosis. I don't have to follow up with the cases on those, but like the BCOsis, the Borrelia, tularemia, I haven't had that one, knock on wood yet. Palisana, we have not had a case yet, but I'm sure that's coming soon. And then I've had my first Rocky Mountain spotted fever. So if I talk to somebody, I'll refer to these. So this is just, I want to give you guys a little more education on the different ones and how they're spread and how they're treated. And then there's also for ticks or for mosquitoes, the Eastern equine syphilis and West Nile virus.
And these are all on the mass.
I got these all off mass.gov.
Yeah.
Yes. And then this is a nice little handout for gardening tips, so you don't get bit. That might be another good one. I got this one off.
What's the tip for not getting hit in the garden?
Don't go outside. My tip. Don't go outside.
Buy your fruit at Big Y.
Yeah.
Right.
I know.
Go wash it.
Okay, thanks. Any questions for Jill or Evan? Thank you. Old business, the work plan revisions and updates.
So yeah, I went ahead and we had kind of an inner working copy. Pat had commented on it, Jim. And so really took a clear look at this because it really is something that will help us as a group know how we're going to operate, right? And it's also a milestone that we'd like to be able to report for the next quarterly report for our grant as well. And so I feel like it's come a long way since we first started it. And it's just, we're at the point where we all just need to focus in on it and figure out if this is how we envision our group running. So I don't know what the process would be for that, but that's where I feel like we're at. Jim?
I think we made some edits recently, you and I, maybe redistribute that to the group.
This is the most recent one.
Okay.
Yeah. But like, just kind of a big overview, the name obviously and the mission and vision, we had already worked on that. So that stayed the same. The goals, those ones were all listed in our IMA. So we had like a lot of brainstorming about goals, and then there was a lot of redundancy. So I just took the goals that were in our IMA for that. So governance, here we are, we're the governing board, right? And everyone has one primary designee and one alternate designee. And so one of the things that is in our packet is kind of in that moment, who it was. Now, since then, like Otis, you can kind of see that I had guessed who the primary was. So Otis, it's actually Brandy. And Terry's last name isn't Page. So there's some progress. So what I'd really like to ask for all the towns is to go back to your boards and really nail down who is gonna be your primary and your alternate. Sheffield's now has a primary and an alternate. Thank you, Sheffield. And get that to us so that at the next meeting we can, I don't know if we need to accept them or but we'll just know where it is and it will be memorialized.
Does the alternate member have to be a Board of Health member?
So, no, so the way that it's written in there right now, and this is something to look at, says designees are typically Board of Health members or Board of Health agents, but might also be select board members or any other person that will represent the interest of the member towns and may include town managers, administrators, council on aging representatives, or other citizen deemed appropriate by the municipality to represent the public health perspective of the community. So that probably couldn't be like tightened up, but what do you guys think about that?
I
Well,
actually circled typically and was gonna ask for people to talk about that, to use a different word instead of typically. I think it's too vague.
Well, and I'm concerned about as determined by the municipality.
Mm-hmm.
What is that?
If it were me, well, first of all, it's Terry Gould.
Yes, no, it's,
Terry Gould, I would put that on the membership board of health to figure out, right? So I would, like, Lennox, for example, Lennox meets it, like, we need to designate an alternate. Anyone on the board interested in an alternate, you get no takers.
Right.
You know, you can then reach out to the town administrator, but that person would report back to the board of health and kind of move that up. You know, like, for example, Brandy Page, she's the town administrator, but she reports that the goings on back to the board of health. You know what I mean? It's one of those things, and if you get to a level where, like, we have someone from their community, that person should apply to the board of health and say, hey, I'm interested in doing X, Y, and Z, and then the board can make a decision, say, okay, you'll be our alternate or Sheffield.
Yeah, no, I agree with that. I'm just concerned that it may be made clear that it's the Board of Health making.
Okay.
Yes.
Yeah.
okay,
Yes.
so designees would be appointed by the Board of Health
Right.
and may be a Board of Health member, but also could be, would that would be more.
Relevant.
That tightens it up a little bit.
Yeah.
Because boards of health actually appoint their agents or whatever. But I guess we could tighten that up, just to kind
Yeah.
of keep everyone in their lane, you know, where, you know, select boards are. We don't want select boards going rogue on, you know,
Yeah.
collaborative and stuff, but that makes sense.
Okay,
Yeah, it looks like, so it sounds like what we're saying is you just change typically to designees will be Board of Health member, or Board of Health agent, or designee, or
Or
someone
appointed by the
designated
Board of
by
Health.
board.
By the membership, by their respective membership board of health. Yeah, each town does their own.
Yeah.
Right, but are you gonna require that the board votes? I mean, you may have a board where the chair is deciding who is doing what. And
It's not our
that's not
job.
our job. That's what I'm
It's not our
saying.
job to manage Sheffield.
Just say, right.
Rules, it's like,
Okay.
you tell us who the designee is and we take.
And that's it.
Whatever means.
Yeah. That's right.
okay, so just for clarification for me, because I want to get this right. So using the existing language, it could be designees are Board of Health members or Board of Health agents or any other person that the Board of Health deems will represent the public health interests of the member towns. Okay. Great. And so that's gonna go on to the alternate designee. We'll use that same language, right?
Yeah.
The section 3 is actually new. It's the leadership committee. So, that was not, Pat pointed out in the original that wasn't defined. So here the definition is. The leadership committee. The board members shall annually elect a president and vice president at the start of each fiscal year. And then, each of these positions are limited to 2 consecutive annual terms. And then adding language of like, this is the definition of the leadership team.
Yeah, because it's referred to elsewhere in the
Yeah.
document.
Are you guys fine with annually electing a president and vice president? Okay, and do we want to have term limits so that all of the towns kind of are represented and like get a chance to participate?
But you have the two consecutive annual terms, right?
Yeah, that's fine for everybody.
Pat, you're on your third, right?
Yes.
Oh.
I-
Remember, the rules weren't in place yet.
Right.
Well, since the beginning,
It's a very.
the minute we started the
It's been 2
governing
years.
board, that's how it's been.
Wow, that's.
Yeah, it took us about 45 seconds to get that.
Now I'm
She
really-
did not have an opportunity to say no.
But now I don't have to say no because my time is up.
Oh, okay. So on the agenda is, so, and the, articles of operation. So we cleaned up the wording for the designees and alternate designees, and then leadership committee elections. I don't know if we want to, I don't know if with this agenda, we could do that, this meeting, or if we would have to do at the next one and actually put it right on the agenda.
I
So you're in it for at
I
least
have-
another month.
I have one question. Do you have to designate a specific time frame for the meeting? For, when you say annual,
Mhm.
do you have to have that in there, or can you just say annual, which is what it says?
Or you
but-
could say, like, we didn't meet in July, you could say at the beginning of the fiscal year or the next.
Right, that's what I said.
Okay.
Right,
Annual fiscal year meeting or something, so he's like, August would be,
right, would be allowable.
Okay.
who wants to meet in July, right?
All right, and so, and then I want to, in section 3, leadership committee, the leadership committee is comprised of the president and vice president.
Yeah.
One thing that I will say, the next section, section 4, working groups. The Attorney General's office did make a recent ruling, I think for a Berkshire town, that, that working groups should those meetings should be posted and, minutes taken and then sent back. So I put that in section 4, just so make sure that we're in compliance with the open meeting law. Any issues with section 4?
Yeah, I would say 5 or fewer. And then 5 or less.
Yeah, right. Thank you.
Or fewer? Okay. Executive committee.
Leadership committee.
No, I looked at that as two different things, the leadership is the chair and vice chair.
So what's the executive?
So, well, something that
Uh,
we may talk about is about. Look, as we're settling in as a collaborative, if the need to meet monthly, for example. Maybe quarterly, and I think, that. Similar to like BCBOHA, where you have like an executive committee where you can meet routinely on things. That's not the entire collaborative. So we kind of define that as like the chair, vice chair. Or shared services manager, like the fiscal host, something comes up in between meetings, right, that needs our attention. We have the ability to set an executive committee meeting.
So in section 5, you are both defining it. Its membership and its role, right? From time to time, the program manager may request a meeting with the executive committee being the fiscal host, manager, chair, and vice chair.
But we still have to report our goings on at that meeting.
No, that's okay. I'm just saying that there are multiple things going on in that section.
I see. We're both defining it and saying what they're doing in the same article.
Yeah, which is okay, but I just think it needs to be 2 statements within that.
Sections, Jane, define executive committee, and then
Right.
section
That's
6.
Then how it's used.
Okay,
Claire, question, chair and vice chair, is that president, and vice president?
Yeah, we'll be, yeah, you should fix that.
so how about, we'll do an article 6. Okay, in between article 5 and article 5. And
Yeah, I thought we were on section, we were on section,
Section 5.
we were on
Yeah.
section 5.
section 5, take out that bottom. So that will just be, the executive committee is comprised of. Right, so we'll define it. Who is in the executive committee, and then article 6 could be, the executive meeting.
Section, a new section.
Yeah.
Section 6,
So-
not Article 6.
So Jane, we're in Article 4, Section 5 is the define executive committee. And then Section 6 is how to report that back up.
Okay,
And then hit Article 5, and then Article 6 is membership.
okay, got it.
Then we gotta move everything down.
Yep, I got it.
Yeah, they're down, yeah, you got 2, 5 and.
Yeah, well, um. So then board responsibilities, so that a primary and alternate attends the board member, the governing board meetings, that's them. Help develop annual and long-term goals, advise the manager on priorities for staff. Participate in adoption of policies and recommendations to member boards of health. Review then provide recommendations on programming, operating and programming budget, and collaborate and develop a sustainability plan for SBPHC. I would add on there, distribute quarterly reports and report back to the Board of Health, their own individual boards of health.
Sure. But isn't there also, I'm not saying this out of any spite, but doesn't this group also evaluate the director,
The director.
the manager, whatever your title is, the program manager? How do you get feedback?
So there has been a
I
shift.
understand the question.
So there's been a shift in that too. Jim's the fiscal host. I'm now the manager. So what I'm hearing is that how does the board evaluate the manager?
Right.
So if that's what she's wondering, if that is a board responsibility, that's what I'm hearing.
I think it needs to be a board responsibility. I don't think it can be just the executive committee.
Yeah. I mean, but I think it needs to be somewhere in somebody's hands. I don't say that because I'm at all dissatisfied. I'm just thinking that as we're codifying things, that's a normal part, is an evaluation or assessment of.
Well, I think we have to have a further discussion now with that meeting.
Okay.
Right? 'Cause we're gonna have multiple employees over the years that are lead employees. Yes, they are collaborative staff, but like, we're not gonna just evaluate the manager. We're gonna have a shared agent at some point, the community health worker.
Yeah. So that.
So I think that.
So I think that, so what I'm also like under the current Article 7. So there is a fiscal host role, and that would be Town of Lee, right? Tri-Town Health Department. So there is information about evaluation there. Of the work plan status of the project, and that is the direct supervisor. That doesn't mean that there shouldn't be more conversation about having the board be able to also evaluate, but that there is that structure does kind of exist.
Well, it's evaluating the work plan status.
Yeah.
So I have to do performance evaluations on all my employees.
Right.
That's my responsibility. But I would entertain feedback from the collaborative on what they're seeing and feeling and whatever.
So maybe
Part of that.
Maybe that's.
But
Yeah.
Feedback or, yeah.
but we're not gonna, I mean, legally, I can't get into an entertainment of another town. Doing an actual performance evaluation on another employee.
No, but what we're talking about is, I'm confused now. Are we talking about the manager of the collaborative? Because the manager of the collaborative should be evaluated. I think I see your point there is that the manager of the collaborative is actually are they under the jurisdiction of the board, which makes sense to me, but we haven't. We hadn't gotten that far.
No.
So I don't know, maybe it's for a different.
This might have experience with other collaboratives or working on that language.
Oh, you're muted.
We get it.
I think this is his first time on Zoom.
Really? I'm running two screens and I was just calling the document up on one screen and I couldn't, and I still had you there, but that wasn't the real Zoom. Anyway, I was calling up the document. Which specific question do you have on?
Well, here's what we're doing, Mike. We have the intermunicipal agreement. That's all signed.
Yeah.
And this, we're trying to set this type of like a cliff notes. As an
I get that part. I have one quick question though. When you say articles of organization, are you actually anticipating incorporating this as a nonprofit or something?
Operation, not organization, it's operation.
Oh, okay, because articles of organization means
Just a
something.
simplified document that the governing board can go to rather than going through, the
And-
IMA.
Which I love and which I'm going to start to advocate that other groups maybe look at yours.
That's what Tri-Town did years ago.
Yeah, this
we
is the first
tried-
one in the PHE program. You guys are.
Yeah, so we kind of tailored to the Tri-Town one because Tri-Town was created under the intermunicipal agreement, even though it's 70-something years old.
Right,
And
right.
the boards that felt at that time, many years ago, wanted a simplified document because there was an argument then that the intermunicipal agreement actually legally has to be signed by the select board.
Correct.
And well, even our IMA, but they didn't want the select board to have jurisdiction of codifying and how Tri-Town operates. So the Tri-Town boards set up their own articles of operation that only they have jurisdiction over.
So
That's
the,
sort of how that got morphed into this.
so the specific question, Mike, that we have is
Thank
looking
you.
at the role of the board in evaluating or providing feedback to the evaluation of the, what is your title?
Manager.
Shared services manager.
The shared services manager.
Yeah,
But before we get, evaluation, I think, is we have a work plan. That's evaluated, DPH evaluates it, we create the work plan, we constantly evaluate that. But I want to be careful on where we're going with this because we have a governing board and we're gonna have multiple employees over time. And yes, they're gonna be agents, but I can't get into Sandusfield doing legal performance evaluations on a Lee employee. So we need to understand how that all works. I would rather see a performance evaluation and feedback.
Right.
Because does Laura Ross get evaluated on an annual basis by the Berkshire Public Health Alliance in an open meeting? Does Sandra Martin get evaluated? So I want to be careful on how we deal with that.
The BRPC.
Right,
It
that's a
doesn't matter,
good
but
point.
the alliance is the alliance, but does
Yeah.
Laura get evaluated annually in a public setting?
It'd be interesting to see how they have that arranged, because I think you're right, Scott, I think that goes under BRPC, and they do their personnel, evaluations. And
because they're the fiscal host.
because well, that's interesting, yeah.
I mean,
So
it's-
maybe that's a conversation let's stick to. Maybe not get into the personnel evaluations at this point. I mean, I don't know.
Wasn't Rebecca asking Mike if he had seen this come to fruition in the other groups that are doing collaboratives?
And he's
Right.
Wasn't
like,
that- he said we're the
usually
first.
we're the only.
But have they discussed it?
No, I haven't seen anything like this come to any of the other groups yet.
Well, I would be very happy just to have the opportunity for the board to comment on or have input on.
I would support.
So
that.
feedback to fiscal host
Yeah.
on,
Yeah.
I would definitely support that. I mean, if we have a shared agent, technically on paper, we look at their pay stub as Town of Lee, but
Right.
they're collaborative agents. If I have an agent that's not meeting Sheffield's needs, I would want to know that as well.
Exactly, for sure.
Right.
Yeah, so the meetings and the responsibility is to provide for the governing board to provide feedback to the manager and or the fiscal host on
Right.
any
On the performance of,
operational
yeah.
or
and where's that, where you,
under Article 5, existing.
board responsibility.
Yeah, board.
Which Article 5?
The first
Article 5, okay.
Will be Article 7, fiscal host and SBPT roles and responsibilities.
Why isn't it a board responsibility?
well, the evaluation, the performance evaluation right now, I think is under fiscal host. and evaluation, but what I had thought is on board responsibilities, which is the first Article 5, it would be, give feedback to fiscal,
Right,
provide feedback to the, fiscal manager on employee or, yeah.
Right, however you want to word that. The one in Article 7 has to do with the work plan, not the performance of the individuals, I think.
Well, I had added it.
Oh, okay.
Are
Um,
let me just ask, are you suggesting in there that that this governing board would provide feedback on individual employees of individual member health departments? Like, say Sheffield had a housing inspector, would you all have input into that, or just your own
No.
employees?
No,
Okay, just collaborative employees.
right.
Okay, I think that needs to be spelled out real clearly.
yeah, because that's what you were talking about, was that you can't have the board jumping in on somebody
Well,
who's employed solely by the town.
We're all collaborative, like, I'm not saying yes or no to certain things, but like, I would definitely entertain feedback on shared
Yeah.
collaborative staff.
On
how they're
shared
impacting
staff.
staff.
I
But
think
like,
Shared
that's
staff,
the
right.
phrase to use, is
But
shared staff.
To do the legal performance evaluation is not something I don't think we can legally entertain.
Oh, that's
right, and if there's an issue at your level, you wouldn't necessarily talk to the board about it if there was an issue, it's not like you would necessarily it wouldn't be appropriate to talk about it with all 13 towns, right?
I mean, I have a shared agent that goes rogue in Sheffield, I would want to know about it.
You would.
You would know, I would want to know, you would want to know.
good. Okay, thank you. I'm sorry. if
This
that-
this is great. This is exactly what we need. All right, so membership addition of withdrawal. So it lists all 12 member towns, okay, and they're called member towns. And in there it says that each board should have the MAHB Board of Health Guidebook for reference. I think this would be great. I know Sandusfield has it. It would be interesting to know if there's any towns that don't have the MAHB. You have it. So that we could get it, make sure that we get it to each board to have in their office. So,
Hey, question on that, maybe to Mike as well. Should we expand on other resources that we would want our membership towns to have? Because, the guidebook is quite comprehensive. We have the duties of boards of health, which is a summary, the manual of laws. Is there any other resources that we could provide? Because I know it's gonna be a lot of trainings come up and stuff that would benefit the membership towns, other than just the guidebook.
Okay, first of all, is each of the towns a member of MAHB at this point?
It's not required.
No, it's not required, but it's
Right.
free. It's free because it's free through the grant. The grant can pay for it. Because if you are a member, you have access to all of our materials online with a password. We have let me just grab this. We have our legal guide. Whoa, almost broke my. We have the legal guide, which you all have seen, I think.
Invisible.
Yeah, it's
It's virtual.
Oh, I get that stupid thing on. I'm sorry. Well, it's 160-page legal guide that is available for sale, but it's online for free for our members. And I think that any of our materials are always available to boards of health. And if you're not a member, I'm sure that we'll still make sure that you get whatever you need, except for the legal guide, which has to be procured online that way or purchased for $100 for a copy. But all of our materials are always available to all the boards of health.
Mike, I have a question on that. And this is probably a Cheryl Sabara question, since she's the executive director.
Mhm.
The last couple of years, I've struggled with MHAB on the invoices and billing for the membership.
Yep.
It's, for example, I'll get one for Lee, which is one rate, one for Lennox, which is a separate rate, and one for Stockbridge. Is there an opportunity for MAHB staffing, administrative, whatever, to send to me as the fiscal host, the total amount of the membership for the collaborative in one invoice. Because it's
I
a
will
lot
make-
of work for my tri-town administrative staff to be processing one invoice, then another invoice, and another invoice. You know, and if the membership towns are okay with us covering those costs, I would like to do one invoice, send it out, and then tell all the towns they're part of MAHB.
Mhm.
So it relieves those towns of administrative, and it makes it easier for our department. I did ask that question a couple of years ago. I never really got a response.
I'm gonna give you a response right now. First of all, have you paid for any of the towns yet?
I am not aware of paying for any other towns other than Tri-Town.
Okay, you will receive next week one invoice for all of your towns.
Oh, wonderful.
And is it MHAB, is that like per town or is it?
Yeah,
per-
it's, and the reason, yeah, and the reason that Jim is having his questions, Jane, is that it's population based. So we have towns, you know, we have, some of the collaboratives have towns with, you know, 8,000 people in the town and a city of 20,000 or 25,000 in the same town. So they're different amounts, but it's done by population so that we don't break piggy bank. But I will get you one invoice for all of your towns, Jim.
And I don't think I'll hear any complaints from the membership towns that they want to pay their own bill. It just makes it easier because we can cover those costs, you know, we got the money for it, it just, you know, because I'm still using my tri-town administrative person to handle a lot of collaborative business. And I'm just trying to make it streamlined to make it easier.
So when you
Right.
say the town is the member, who is the individual? I mean, somebody has to hold the password. How is that then?
I don't know, I can, Mike, we would have to figure that out.
We're actually, okay, so it would be any of your Board of Health members or your staff for your health department.
Password.
Would be
Okay.
considered individual, but the membership actually belongs to the Board of Health because we are the Mass Association of Health Boards. So it's that actual Board of Health membership.
But it can be legally shared among the whole board. That's. I
No,
know.
your dues, it would show that your dues are paid for Sheffield, and your dues are paid for Great Barrington, so you'll have access to your own
Mhm.
passwords.
Right.
Now, in exchange for making Jim's life easy for him, I'm gonna beg everybody here to, within the next week or so, just jot down, I want to see everybody's pens on your paper. Send Mike membership contact. We don't have contact information for the Board of Health members because they change so fast. We have another election coming up next month for about 10 towns. So that's going to be new members. It happens every month that there's a turnover, there's resignations. Please send me your contact information for your board members so that we can get to them directly too. But but I will make sure that you get that. Every board member in Massachusetts, if their town is a member of MAHB.
Okay, yeah, and I have a list for you. I had sent it out a while ago. There have been changes, so
Yes,
I will
yeah.
get that to you.
Okay, thank you.
Okay, back to the thing, sort of jumping ahead in section 5, article 5, section 4, on withdrawal.
Mhm.
It says any excess municipal contracted funds would be returned to towns if not allocated or spent. I think the word should be encumbered. I mean, you would.
Yeah, that's.
Yeah.
And I've got another word for you to add in that, not that section, but the section above it, section 3, additional member towns.
All right.
You say considered if there is capacity and geographic capacity. I would put the word workforce before the first capacity.
Okay,
Yeah,
It's a little
Thank
bit,
so how about workforce and geographic capacity?
yeah, that's fine.
what does geographic capacity mean?
Well,
Some of
so
it-
like if a town, oh, so
No,
when
go
I-
ahead.
when I
because you're
wrote
gonna say
that, like,
something.
if Windsor came to us and was like, we really want to be part of the collaborative and it doesn't make sense for us, right? I don't think we're looking to expand. Just in general, we're not looking to expand, but like, but if it doesn't make sense for the collaborative, if there's not a compelling reason, then why would we dilute our own capacity to expand if it did make absolute sense?
Like going to another county, for example.
Right,
Mhm.
go into another county or another part of the county that we wouldn't be able to manage.
So maybe geographic capacity isn't a
I
thing.
don't think the word capacity should be right there, geographic relevance or geographic.
Or workforce capacity, is that enough to the?
How about feasibility, geographic feasibility as one? Because I know that, I don't know what your traffic patterns are like, but I know you're a destination, a vacation destination. And we see this on the Plymouth County groups that you got to think about that Friday afternoon traffic to the Cape. Do you really want your inspector sitting for an hour in traffic because one of the towns is disconnected by 3 towns from the rest of the group?
Right.
Right.
All right, yeah.
So what are we writing into geographic what?
Feasibility.
Feasibility. Okay.
I think that's enough to give a compelling reason why, like, I love Windsor, but like, if Windsor comes, I'm like, nope.
You can't, if you can't get there from here, you don't want them.
Yeah, that's right.
Maine. I'm from Maine, so that's what
Well,
we.
but I think
Yeah,
we're
but
all,
there's towns out here you can't get to from anywhere.
Yeah.
Like Mount Washington. Oh, wait, they're a member.
Actually, or.
Parts of the border.
But I think, aren't we also saying if there's a more logical reason that they belong to another group?
Yeah.
Yeah.
Okay, anything else? I think this is sufficient that you're gonna need to send it out
Yeah,
again.
yeah.
And have us.
I'll highlight the changes
Good.
and it will go out again. I just, we haven't really ever as a collaborative focused on it and it
Right.
just feel like it's time, you know what I mean?
Agreed.
Are we still on old Article 7 or are we talking?
second section 5.
What do you want?
No, I'm
I think
kind
we're-
of curious as to where we are in the.
Decision-making process.
Thank you.
Article
Um,
6.
Okay, so this is decision-making process. It will be made in public meetings through discussion and by consensus of the boards. When not all possible. For time-sensitive matters such as time-sensitive grants or work plans, the manager may confirm with the executive committee to give guidance on those matters, which will then be brought to the next scheduled board meeting. I feel like this is a little bit redundant of section 5 of Article 4 governance under section 5. I think that probably that maybe we just define the executive committee in section 5 and then what do you guys think about decision-making process
Put it there.
and put it there?
Yeah.
That's the only change that I would make is again saying decisions are typically made. I would say decisions are made in public.
Yeah.
Unless.
Okay.
So where do we ever use, and I know that we use the leadership committee thing. Is that?
Well, I think that what happened is, I think maybe we should just change section 3's
Oh, it says
wording to, board leadership. Just for so that we talk about, president and vice president.
Yeah, I see it comes up in Article 9, Section 1, leadership committee meetings.
One of the ideas maybe is change leadership committee to leadership term and define the term of the chair and vice chair and then get rid of everything else.
Yeah.
Okay.
So leadership term.
And then just fold the executive committee, everything else into.
Okay.
Yeah.
I'll clean that up for the next meeting and we can take another look at it. All right.
And do you need to define, when you say time-sensitive matters such as time-sensitive grant or work plans? Is that really necessary to put in there? If you just say for time-sensitive matters, the manager may confer.
Yep, that works. I just,
Yeah, Or do you like it in there?
I like the examples in there so that there's a comparison if suddenly the manager decides that something, I don't know, but that it isn't time sensitive, and so he's not gonna consult, or I think the examples provide a baseline for the kind of thing we're talking about.
Okay. So,
It sounds like I'm not trusting him, and I don't mean that, but these are meant to go on for a long time.
When we're
You
not
don't trust
here.
me now, you're in trouble,
so then fiscal host, this is where we are talking about, Jim. The fiscal host, is that defined? Should we define fiscal host up in governance or? No, okay, so fiscal host is to work with the program manager to meet full compliance of the grant and its deliverables relating thereto and meet compliance with its funding partners. Tri-Town Health District, Town of Lee is sponsoring and fiscal host agency and shall be known as the fiscal host. I think that should go first in that paragraph. So,
Well, here you've also got the issue of setting, well, this isn't quite in articles of incorporation, so of setting it in this document that it is Tri-Town. 20 years from now, if it's not Tri-Town.
then you change this.
you just change this.
And that's the whole thing, is that you don't have to go back to the IMA and change it. Like, this is a living document.
Is there takers for another town to take it? I'd be more than happy to give it away. Not really, I'm just saying.
No. I'm just trying to think about the big picture. Okay, but I'm not sure why we don't define fiscal host in section in governance or in somewhere.
I think it's two different things, I think. Governance is defining the governance of it, whatever.
Right.
Opposed to this. Which is language pulled from the IMA.
Okay. So
Yeah, this doesn't change the IMA, by the way, this is our kind of governing,
get it.
you know, example of the IMA. You can't make amendments to an IMA without going to every member town and whatever.
Right.
It's kind of like bylaws, right? That's
So
why
the
we're
IMA
about-
does
like-
not state that Tri-Town is a fiscal home? It's surely not.
It's in the IMA.
Yeah, so if that word.
So if that changes, you have to change the.
Right.
Yeah, you would have to change that. Mhm.
Okay.
All right, so, so interestingly enough, so section 2, evaluation, so fiscal host. So then it talks about the board working unison with the fiscal host manager, working groups funded and unfunded partners, and all other key stakeholders shall conduct routine evaluations of the work plan status of the project. I think that needs to should change to, fiscal host responsibilities, and then the other responsibilities would go into the board responsibilities. So I'll clean that up for the next meeting. Do you know what I mean?
Mhm.
Okay. Conflict resolution. Grievances shall be presented to the the board within 90 days of the occurrence. So then do we want to create a policy? I have one in the books. Jim, that was Jim, yeah. So,
It's more personnel staff, you know.
Yep.
all right, and then the last thing is meetings. So right now, we have to meet at least quarterly per our agreement with the state. And so, so I put that in there. Meetings will occur quarterly as otherwise specified. We might just in practice want to get to the point where we're only meeting quarterly, you know, as we kind of move forward. So what are your guys' thoughts on that?
Well, at least quarterly. If you wanted.
Right, to reserve the right to.
Right, to do it
Yeah.
more frequently.
If we were to meet quarterly, would the executive committee then come into place for a more regular
I think so,
meeting?
yeah. That's what my thoughts were, because it's
Monthly
too
or
much of a
as
stretch.
Or as needed? Would there be a structure to executive committee meetings or just as needed?
Where we have to everyone else. I mean, if the collaborative wants to meet quarterly, I would like to see check-ins.
Yeah.
You know, we're just. The four of us, whoever is gonna be the next chair, vice chair, just, just check-ins. See how things are going.
We want to say executive committee member meetings as needed, with additional executive committee meetings as needed, and then, as the executive committee, whoever's on it, can decide if we have something coming up, we would meet, or maybe we decide to meet monthly, or,
Right, well, so I think you need to say, will occur at least quarterly.
yeah, at least quarterly, yep.
Just a note on the title of section 1, that should be governing board meeting.
Yeah,
right?
yeah.
There is no leadership.
That's right.
Let me fill you in on a side deal that we're making with the Attorney General's office that will affect this. There's always a deal being made behind the scenes, it seems. One of the issues that's come up with the collaboratives is posting the meetings. And we have somehow or other been able to get in touch with the person at the AG's office who's in charge of the Division of Open Government, and she's helping us out with the collaboratives issue. And having a quarterly meeting in your bylaws and now in your operations manual, or whatever this is going to be called, allows you to differentiate between working groups and noticeable meetings. And it's going to allow some of the groups to have a little bit more flexibility. Any public meeting that you're having, and we put out a memo on this, I think a week or two ago, or maybe I think last week we put out the memo. But any public meetings have to be posted. You all know that. Collaborative public meetings only need to be posted by the host agency. So one of the things that in your next meeting, I'm going to ask you to put on the agenda, Jane, is to adopt the posting standards. And I'll give you the right language and all of that. But what we've worked out is that each of the boards of health in the groups will take an affirmative vote to have all of the meetings of the Public Health Excellence group that they belong to posted only by the host agency, or the host town, I should say. So your fiscal host will be the only one that has to post. And you will have to put on your webpage a notice that you have that you participate in the PHE program, and that there are meetings from time to time, and those meetings are posted on the usual posting method of the town of whatever it is that you have as your fiscal agent. And they would post it as a meeting on behalf of all. Your individual towns would not have to post anymore.
That's amazing.
Mike, I'm very familiar with this law. This came up at Tri-Town under some issues.
Right, and I think that one of the things with Tri-Town is that you're a collaborative on several other things, so you should be able to do this anyway. If you're on, you have to notify the AG, and we'll walk you through it when the time comes. But you notify the AG, and they put you on a spreadsheet. And so anybody in the public can go to that spreadsheet, and we'll see Tri-Town as a listed agency that's been authorized to do this. And you'll be able to do that after that, Jim, with all of your other meetings that you do with Tri-Town. So I
don't want to get complicated with this. So right now, I'm familiar with this law because this came up on one of our open meeting law issues that we were found not guilty on, by the way. The legal, so can other towns still post the agenda if they so choose?
Oh, sure.
Yeah, so there's that. So but Tri-Town is not the legally designated posting right now. The town of Lee is, because that came up on our open meeting law. So Tri-Town actually never went through this process yet, because there was confusion on a Tri-Town issue, not a collaborative issue, that we post everything on the town of Lee website and the 3 towns, but Tri-Town also has a web page. We still post. And there was one meeting which we got dinged on that I forgot to post an agenda on the Tri-Town site. but we were found not guilty because Tri-Town actually was never the legal posting site. So is this a two-step thing I need to sort out with Tri-Town?
Well, you'd actually post everything in the town of Lee.
Yeah.
So Tri-Town itself is sort of an irrelevance, because I think that this group might not, does this group line up exactly with what the Tri-Town group is? For other purposes?
No,
No,
Right. So it's a separate entity. We're seeing that with the Cape, where the Outer Cape wants to have their own bylaws. And then we're trying to explain to them, it has to go for all of the towns in your group. So let's do this clean. So what we'll do is we'll establish an entry on that Excel spreadsheet with the Attorney General that says South Berkshire Public Health Collaborative or Excellence Collaborative, whatever your legal
So
name.
Lee is the legally designated posting site right now.
You'll all designate Lee as where you're going to be posting those notices. And so you only have to do it once and you're covered. We will be we're still working out what it is that's permissible not to post. Because there's going to be conversations you have where you're just going to be talking about, are the inspections being done once you have inspectors in place, or we had a fire at such and such a place. Can we do some of our shared services for the benefit of that apartment building or something of that sort?
And for those that aren't familiar with this whole process, the easy example would be is we set up today's meeting. Jane sends it out to all the clerks, including Lee. And Ellie forgets to post it in her town. If someone filed an open meeting law against Mount Washington that it wasn't on their site, we would be not held liable under the open meeting law violation. That's what that means.
Right.
and right now we have even a further layer, we have a FBPHC. All of the meetings and minutes, the agendas and minutes are listed there, but that's not an official place. And so like the question that I'll have for Mike, and I think the answer is probably no, is, the town of Lee couldn't just reference that. It would have to be posted per the town of Lee. And then that could be extra, but doesn't mean that we can't do it.
Right, no, I don't know why you couldn't.
Yeah.
And the other thing is, I'm piloting a system right now, and I'm going to see if it works or not with my group on the islands, which connects to your Zoom, and it makes a complete transcript. It recognizes voices, believe it or not. So it'll say Ellie said such and such, motion by Jim, and it'll do all of that, and then at the end it generates minutes for you. So,
which then have to be very carefully edited. Having used this program, it does not always recognize who you think it recognizes. This doesn't mean what you think it means.
Santa Claus then.
Well, Mike too, like
But, yeah.
that creates like an official transcript, and they're,
It's-
you have to be careful what they say.
It is dicey.
So on and so forth. It gets flooded with a lot of stuff that's more than just motions and
Right.
all that kind of stuff.
All right.
yeah, I'm going to see how it works, and if it works out, listen, with my mouth, I'm gonna get in trouble. I'll be the first person to get in trouble, I promise you. So
So I feel like I've gotten the articles of operation. I feel like I've gotten a lot of good feedback. I'm gonna clean those up and turn them right back around to everybody, and then
Right, I just, one last thing in the meeting section, I think, I don't understand now the difference between section 1 and section 3.
well, it was changed.
Right.
Right,
Okay,
so that's what it is, yeah.
Good, great.
So section 3 is probably just gonna take,
2 items.
yeah, just 2.
There was just one other thing that it's the difference between may, shall, and will.
Mhm.
Which I would just say in general, you want to go over and think about this, because at one point it says that so-and-so may collaborate, you may, and you may want to say they shall,
Mhm.
or
Will.
will,
Yeah.
or whatever, but be careful of those, because man, they.
I made a circle, may, shall, will, and be very deliberate about what's there.
And also, commas for parenthetic phrases, thank you.
Are you for them or against them?
Absolutely. Catherine Gibbs graduate, I am definitely 4.
I'm for.
You want to have Rich look this over before you send it on, Jane?
Yeah, so are you guys okay with, I'll make the changes, maybe see if Rich Mucci can look at it, and then that'd be great, Mike.
Okay,
Okay, great, thank you.
Okay, I think we have done the article, well, wait a minute. There are two things. Can we take action based on this?
No.
No, that's not that wasn't the purpose of them. I really just need everyone to look at them.
Okay.
So if I may, Madam Chair, I need to like say a couple things real quick regarding the shared services manager position and how we got to this point. It's nowhere on the agenda, so I'm gonna use the articles section, so just so everyone understands, so Jane is now full-time, you know, she's kind of came in half-time, third, 2/3, whatever. And, you know, and based on her performance and what she's taken on since the collaborative started, when we pulled her in. She's really taken this collaborative to the next level, and, you know, it's this was the thing that I kind of took on initially, and now we got the governing board, and. So I've been putting a lot of effort from my perspective into the collaborative over the last couple of years. And now we're at this really good place now, that we're moments away from getting a shared agent, assuming the state approves our work plan and whatnot. So I've been kind of burning both ends of the candle for the last couple of years. And so now that we have the right people in the right leadership positions, Jane, Jill, and others, I'm kind of reverting back to where my old place was. And I'm kind of giving up a lot of this collaborative stuff, other than obviously, I'm still the fiscal host legally. I gotta sign contracts with towns and I gotta do certain things, whatever, but Jane is really taking this on, and she's earned my trust and hopefully everyone else's. So she's really the point person now with collaborative daily goings on. You know, I still gotta submit budgets and, you know, all our financials and stuff. I'm obligated to do that legally. But I want to just be like a voting board member, provide feedback like everybody else. So anyone has any questions or concerns should feed that into Jane. We speak every day, and, you know, Jill as well, you know, Jill kind of came in, she was promoted to nurse leader for things that she's doing, and Jane's doing the same thing, and I want to thank both of them for everything that they've done to help me get to a certain place, and I feel like in my career, I'm kind of going back to my regular tri-town goings on. It has been sacrificed a little bit, but the collaborative is in tip-top shape, and we're only getting better as we go, so that's sort of like where we're at.
Here,
Yes.
a motion
Thank you,
to
thank you.
acknowledge and appreciate the work of all of the leadership of Jane and Jill and
Especially Jim,
Jim.
yeah.
Jane, Jill and Jim, sorry, I appreciate it. Great. I really would like a vote of confidence, I think, in this team. Is there any interest in making a motion of that?
How would we word it? How would we word it?
Pardon?
No, I'm thinking to myself, how would we word it?
Okay,
I
so
agree.
Well, it's not on the agenda, so
No.
it's just,
All right, so.
you know, if you want to give a vote of confidence to Jill and Jane, you're more than happy to do so.
I'll put it on the agenda for next month.
Okay. What we didn't go through was the work plan revisions and updates as opposed to the article.
Mm. Yeah, so they are attached to your. Right?
This big thing?
Yes, that big thing.
that's the big blue one, right?
It's very similar to what we had already gone over. Basically what the state wanted is they took what the assessment was, the card assessment, right? And they identified areas, so administrative, environmental health, shared services, tobacco, right? And so what we did is we went through and what was presented last time was basically like for administrative, giving support and forms and a function to support towns to get so that they're meeting the requirements, they understand it. So like, for instance, I would envision at some point having a complaint books that are bound so that it meets the specific rule. And it would get sent out to all the towns to be able to be used so that we would meet that, right? We're just trying to check boxes off. And so the role of the collaborative will be to provide the support to do that. That will heavily be part of my job once I'm not, especially now, once I'm not doing a lot of as much inspections, because the inspections, I'm also pulling double duty right now. Same thing goes with a shared agent. We are in the hiring process. We have some good options. And so as soon as we get approval from the state, I would hope that we would be able to move forward on that. And we will be very happy, I think, with what we have. But that person would be making sure that, providing, they would be qualified and providing the support so that the town can check that box. So when the state does another evaluation, we'll do better than we did initially, and that's the goal. It was made a little bit difficult because, so meeting the standards is really the whole point. And there's also a very much equity lens to it, but they don't want the equity lens to be part of the work plan. They just want it to be embedded in every step of the work plan. And so you'll see 3 times for each one of these pages, it will ask, your goal, what's the equity part of that? It drills down, and it was hard to tease that out because when using their example that they gave about equity, they zinged us that didn't meet the standards. So I think that it's a solid work plan. We might get a little bit of feedback. And now you have what was submitted to the state. So if you have feedback, right, now is a good time to look through it if you disagree with anything. Because it's not too late to be like, actually, we presented this to the board and they actually, there was a member that was concerned about that. We could have internal discussion. We could talk to the executive leadership team and then make that tweak if needed for the state. So, but this is what was submitted.
Okay, so clearly this is something that's gonna require a little time to go over. I mean, we can't sit here and do it now.
Yeah, it's time to go over.
But to
Substantially,
contact
it's
you-
similar. Yeah,
right, contact you with anything that is of concern to us.
yeah.
Okay.
Blanked out, whatever, what's EJBG?
Yeah. Environmental justice block groups.
Okay.
There's several environmental justice block groups in our collaborative. Primarily, they're either lower income areas, or areas with a lower base income, and then also higher levels of immigrants. And so those are areas that we need to identify and make sure that we are serving. And the interesting part of that is, like, we knew Spanish was something, right, that we should be paying attention to, but there's also Portuguese and French. And so through the whole process of identifying them, it was interesting to be like, I would have never thought about French. So,
Big time with Haitian.
Yeah.
Haiti.
yeah.
Okay, so please look at this in a timely fashion and get any comments you have to James.
Yeah.
Great. All right, new business. Is there any other old business somehow that didn't get on here? All right. Financial balance.
So this is just kind of, this is a basic in and out, right? So we have, this is actually outside of the public health excellence grant. Because there's, right, so, well, actually, so the income for fiscal year 22 and 23, because they were kind of blocked together. So initially, the first year, this is what we got from the VNA funds for public health nursing, right? Second year, it was what we had the first year plus Great Barrington, Tyringham, and Sandusfield, because we expanded our services, our public health nursing services in those areas. This represents for fiscal year 23, what we got back for COVID and flu vaccine reimbursements. Okay, so the non-public health excellence grant income is the $181,000 that you see there. And then for expenses that were non-grant expenses, we had to do a portion of our flu vaccine purchase. We did get a little bump from the state for our first year. Supplies, right, additional expenses, overtime, technical, like office setup, things that weren't able to be in the initial work plan for the grant. And then, of course, then this year's full flute purchase. And so our costs were 105,000 essentially. And so what will be the conversation in the coming is, you know, we basically have $76,000 kind of positive. And, but there also are some upcoming expenses, like for instance, in our work plan, we asked for a community health worker, and then
We did an equity access coordinator.
we changed it to access coordinator. Actually, they said. But that person's gonna be key, and the grant is only paying for half of that. And so the other half, right, we could make the decision as a collaborative, like, that's an important role. Here's what we envision for it. We haven't even created the, you know, so that's one place for that. Other things are the COVID vaccines. If we have to pay for COVID vaccines, that's gonna be a big expense. Honestly, that could eat up a lot of that. And so it actually could eat up all of it if we really.
I was gonna say, pretty much done.
So so that's kind of what we have to work with for the things that are important to the collaborative that aren't covered under the work plan. So that's what that is.
The COVID costs are going to be interesting and very expensive. Albeit we will get reimbursement.
Eventually.
They're talking, you know, I think we estimated almost like 90 grand for COVID vaccines, private purchase that we would be on the hook for.
And that's only at 40% of what the levels of vaccination we saw last year. So it wasn't even like, well, we gave this many COVID vaccines last year, we are going to give this much. I think my estimate was at 40%.
Is the RSV gonna be handled pretty much by pediatricians, or?
I don't know yet. I don't know.
Because that's gonna be another big chunk, because they're talking RSV for vulnerable populations, not just kids.
So that's a conversation, yeah.
Yeah.
I've had these conversations with the staff before about expansion outside of routine flu. But we have to look at demand, the cost, you know, and whatnot. It doesn't make sense to like spend all that money to give 2 RSV shots, right? For example, and it comes in a lot. I don't know, it's something that we should always be thinking about
Oh, yeah.
outside of that.
Well, it's concerning, I think, because the state doesn't really know what they're doing yet with it, and we're really coming up on it very, very tight. And what I don't want to see is the collaborative get put in a position where it's not available to a lot of other people. And of course, it's all in the news.
Right.
And then everybody starts getting all wound up about it, and we kind of don't have an answer because we're not being given an answer. But that kind of what happened with COVID, and that wasn't comfortable.
Could we look to see what it entails for reimbursement?
we have.
Cost of RSV?
We have talked to our billing agent, and it changed from one day to the next. So initially it was like, can we bill through you to get reimbursed for RSV? And the first answer was no. The second day, they're like, actually, it just got improved. So it is like a evolving thing. And we've talked about maybe getting a little bit and see if there's a demand for it. But we just don't want to put ourselves in the situation
Right,
for the
exactly.
65 and olders that will likely be eligible for that to purchase.
Well, and the availability in the pharmacies is also an issue.
Right,
People
and-
got quite used to going there.
Right, which is great. I think that the operative thing for me is that we have an answer to people so that we can answer public questions about it. And you know, what happened with COVID was that nobody kind of knew anything, so everybody started getting all kind of crazy. So the sooner we can get an answer and say, oh, well, we're not handling that, but you can get it through your pharmacy or this, because then what we also have with the pharmacies is what they're telling me is that corporations like Big Y and Price Chopper are not funding pharmacists to be there to give the vaccine. Even if they can get it, they can't do it because they're also waiting on the people filling the prescriptions, and they're not being given extra personnel, which then creates that frustration thing
So
that.
it's not good advice.
Is there a way to determine desire for COVID and RSV shots before we go ahead and purchase them?
It's a good question, because my concern is we invest in COVID vaccines and the demand's not there.
Right.
And the
Right.
cost, we keep talking
I think
about-
if we order a small amount, and if we go through that, then we can order more, but I don't think we need to order a huge
Yeah.
amount.
Although with the
Um,
resurgence, I think there's considerable.
Yeah, and I've had a lot of people asking about shingle shots.
Yes, because they're being
Yeah.
very much hyped. I think looking at social media, the news media, and sort of gauging how much public awareness, I know it sounds stupid to be in that position, but honestly, that's when this stuff pops up. You know, you start seeing it in the New York Times and all of a sudden you got 19 people in Mount Washington calling about it, which is a lot up there.
That is a lot.
So, yeah, I think just sort of us all being aware of seeing when it starts ramping up, then we can kind of press forward for maybe some better.
And they're not
information.
sure when they're gonna release the newest, the monovalent.
They
That's
don't
the
know.
thing. They're saying mid to late September, we'll
Right,
already be in the throes of our clinic season. We're not gonna have COVID to offer.
right.
So,
We are working with CHP though, with our scheduling, so that we're hoping that, especially those early ones, that they'll be coming back to those communities to clean up. I just wanted to mention that. Sorry, Scott.
Will we not have COVID to work with because we're
it's not
concerned
available
about
yet.
cost? Oh, it's not available.
It's not available yet.
It's not
When it
available.
becomes available, we can order some. So I know for the state is gonna offer it for the kids, we'll be able to get it for them for free. The, 18 and under, but for the adults, we're probably gonna have to pay out of pocket. That's my understanding.
Yeah.
Yeah,
What-
so it's how much do we order? Like,
Yeah, and how much is it, and is it,
$100 a shot, 100 to
So-
130.
is the concern that we really don't, that we need to find more money from somewhere else to be able to support?
No,
We
not
think-
right now, because we just sent out the invoices for the FY 24 contracts. We haven't collected them yet, so obviously, we have 76,000, right? We're collecting 40,000 in FY 24 contracts, that puts us at 120. As we start doing we've already purchased the flu. And I'm pretty impressed on the reimbursement process, to be honest with you. They're still trickling in, like when
Yeah.
Jill does his
It'll
job,
trickle.
like a couple months later, now that we're in the system.
Yeah.
So, we're still gonna get another 100,000 a year from now, if, assuming we keep doing what we're doing.
It'll
So financially, we're in good shape, but we need to be prepared
Mhm.
that, it could. I don't wanna be dropping 100K on COVID shots and like, no one shows up for them.
Yeah, does it matter if you do it, 200 at a time as opposed to 500?
Oh, yeah, what
No,
Joe's
you can-
saying.
yeah, like I would order. I guess it all depends on how it comes packaged. If it's single dose,
Which is what I think.
it's gonna take up a lot of room, so I have to consider because we need to make sure our flu is priority number one that we paid for, that we have room for all of that. So I have to see how it comes prepared. Is it do I have to draw it up? Does it come in a pre-filled syringe, that type of thing?
Right.
So, trying to think how many. if
But there's
it's-
a bulk discount in any case?
I don't know. I'm gonna reach out to Pfizer, to see what the deal is.
Yeah, how much
They know.
flexibility we
Here's
need.
what's in the back of my head, I'll just throw it out there, it's one of those things, but if there's a concern about struggling to have enough capital to start the process, because you buy the vaccines and then the reimbursements come in, and that really supports the next year, and then they see that, with the alliance. So one of the thoughts I have is, since some of us are alliance towns, is going to the alliance and requesting some vaccine seed money, essentially. Because a lot of that money came in, it has nothing to do with the PHE grant. See what I'm saying?
Because a lot of that money was made in the actual town.
That's used in our towns, would
Right.
be reimbursed from, our people as well.
Well, I'm surprised they didn't go back to the towns initially, because they made millions on the COVID clinics.
Could be a.
All right.
So that's not my say, I mean.
That's my point, is
Yeah.
that if we good, you know, in the spirit of collaboration, you know, make the request for some seed money. And it's not like anybody made millions. There's a lot of money sitting there to figure out how to be used efficiently to support the towns in the county. So it can be part of that.
My perspective is the town should ask for that, not us, because we're, you know, if they made. And that's why, like, how we're doing this stuff, we're trying to like crunch numbers, see how much money we spend, how much we pulled in as a collaborative. But like, if they gave 300 COVID shots for Great Barrington residents, what's the revenue that they pulled in for Great Barrington residents? Why shouldn't Great Barrington get access to that back to the town?
Are you keeping
I don't know.
statistics at that level?
Is that?
Are you keeping statistics at that level?
Well, we can poll.
Oh, yeah, we can run
Yeah, we
reports
have those.
to see.
Color polls, we can run a report on how many Great Barrington residents, when we did that cost beneficial thing last year, that's what we did. We said, all right, how much we spend in supplies, you know, Great Barrington Clinic, seniors. So like, I'm not gonna, I will not ask the Alliance for money, but each town should ask their own questions on that. Because the flu thing, I struggled years ago with the VNAs. We would pay taxpayer dollars into the VNA for a flu clinic and they kept all the revenue. And so like, for me, it's like, that should kind of go back to the town, because if you're using taxpayer dollars, the contract, the flu clinics, what are they doing with the revenue? I don't know, but if there's all that money sitting there, but Great Barrington and Sheffield and others should ask for that. And I talked to Bobby Orsi, the chair of Pittsfield Board of Health. Jane and Jill are helping their public health nurse kind of square away the Medicare paperwork, because we had to suffer through it. Well, Jane had to suffer
Jane suffered
through
through
it.
it.
But like, you know, like, for example, the fundamental question is during COVID, they donated their staff to run the clinics, but now they have no money to purchase a flu program. They should get some of that money back, so they can feed themselves as Alliance membership to get their flu program up and running.
But you're right, that has to come
Yeah.
from the Alliance members. That's not for anybody else to do.
Yeah. Yeah.
Well, and then there's also the vaccine equity grant that,
They'll do Great Barrington, New Marlboro that are sitting here and.
Why-
Wow.
Could we draft a letter as a collaborative? I mean, it wouldn't be coming from.
But not all members of the collaborative are part of it.
Yeah.
No, I think the letter has to come from you and me,
Yeah.
and say, we'd like to consider, have you consider Alliance, retain some of that, which then we could dump into the,
And then we can purchase your COVID shots for you. I mean, or, you know, whatever, just,
right?
yeah.
But part of the trick is, if it goes into the town, it doesn't go into my budget, so.
Yeah.
Well, then.
well, maybe you
kind of
could
fight
ask,
with your own town about.
you okay? Maybe you could ask for them, like, to work with us to purchase the vaccine
Right.
instead of the money. So that's an interesting thought.
I think Pat mentioned that when we wrote it out to Ludlow on Wednesday, that I think the Alliance is going, I don't know if it was flu or whatever, they will purchase it. Pat will run it through Color. The Alliance will go back the actual cost for the flu vaccine that they gave, but the Pat would then, or Pittsfield would get the administrative fee.
Mhm.
So I think that was how they were helping them.
Okay. Definitely interesting. We can,
Yeah, somebody can figure out how to.
I mean, where they send the check to, it doesn't matter to me. I mean, it's just, if you can grab some of that seed money, if it's needed.
Right, that's my point.
We go,
Figure out a way.
look at guys, we have a special revenue account for the collaborative. It doesn't go anywhere. It doesn't disappear, it doesn't go into the general fund. It goes into the collaborative account, special revenue account. And so it's protected,
Right.
you know what I mean?
Okay,
So,
well, if somebody
yeah.
can figure out a draft, and I would be certainly willing to consider it, I'm not sure how.
that was gonna be New Marlboro, Sheffield,
Great Barrington.
Great Barrington.
because I think you have to be a Alliance member, Alliance member that's been going to the meetings. like in order
Yeah.
to even ask, so.
That's right.
Yeah.
See, now that was one thing that I wanted to bring up about our things, when you're talking about member towns. Are you going to require that they attend a certain number of meetings before they get, because that's one of the issues that is happening with the Alliance. Is that you just get booted out, but then they use your name to get their stuff, and I would hope that we wouldn't. But I think it's only
We
fair to
have,
put it out there.
we have to have a quorum to have a meeting.
Yeah.
You know, we should encourage, I thought Lee was gonna be here, because I'm actually the Stockbridge rep now, but we should definitely always encourage, but I will tell you, it's really hard to get volunteers and to
It is,
put
right,
additional mandates and restrictions on could go the other way.
Yep.
We should, but you know, like, we have, overall, we have pretty good representation. Tieringham struggles, they don't work Fridays, don't have a lot of staffing. Otis usually comes, Monterey usually comes, Sandusfield comes, and everyone else comes. Overall, we have a pretty good attendance record for the most part. I don't think we'll ever expect 100%, but like, I feel like I want to be collaborative. I'm not in the business of booting people out, but if the town doesn't show up and we make a decision on
then
important
they're gonna
things,
have
they
to be
can't.
happy with it.
But Jane does a really good job on sending routine updates to people,
Right.
and that's why we should really capitalize on these delegates too, because we're all super busy, but we should, that's why we keep hybrid meetings, you know, rather than in person, it makes it hard.
Okay, we need to move through the rest of this agenda. New regional health agent update, you sort of referenced that. We should be getting.
While we're interviewing, we're waiting for the state to approve the work plan and the contract, and, you know, we made a decision to advertise early, just to get ahead of the game to prepare. I think it's gonna be a game changer, you know, and I think from a process, there's the staffing hiring, but then there's a process perspective to make sure if this person's meeting the needs of everyone. Not every town may or may not need that support, but how can we support and get back up and, you know, try down, and I can't speak for Rebecca, but she's got staff and like, we're sort of okay, but if we're on vacation or something, the shared agent can play a role in that. You know, we're not gonna force this on to everybody, but it's a shared health agent that's gonna really help us, and really all I have.
Does the shared agent has to have a first name starting with J to work with? James? You know?
Well, it bumps them up a little bit, just a little.
All right, thank you. So training hub, I think we have a set of slides that were used for that meeting, which I personally didn't go through, but any other comments on that?
I mean, I've been struggling with what I wanna say. I mean, I can tell you what Jane and I've been working on. Jane, jump in anytime. You know, we actually met, I've spoken to Mike about this, I've spoken to Cheryl Sabar about this, I've spoken to Laura about this. Jane and I met with DBH to try to advocate a different way of not utilizing the training hub. It's not that I'm against Berkshire Regional or the Alliance, I just don't have a lot of confidence in the DBH that they're going to be able to pull this off. And that kind of trickles down, I actually don't have confidence in Berkshire Regional, not because I don't like them or anything, but like the qualifications of a master trainer is significant. When they came to me and Jane privately and said, hey, we'll give you 300 grand to be a master trainer, I said no, because unless I quit my job or a couple other people quit their job, there's no qualified master trainers in Berkshire County. Jeff Kennedy retired, which is a huge loss. You know, and there's a handful of people, and there's people that are qualified and ready to take the RS, like Rebecca. I have a couple people in my office. You know, Scott, there's a few other, but we don't have a lot of capacity in Berkshire County. When you go past like Great Barrington and Tri-Town, it's like nothing. In the next group of capacity is really Berkshire Regional. You start looking at Dalton and Adams and North Adams, they're struggling. You know, the Alliance towns are struggling within themselves to have their own capacity. Then you got Alliance inspectors are covering 20-something towns. And so I'm really concerned about the training hub because I'm sorry, I'm not gonna have a new health agent that has 6 months' experience to teach my staff of 10+ years how to do housing court. You know, like, I don't need someone teaching me with no experience on how to do a Title V. So there's these challenges within challenges, and, you know, the process of selecting the hubs was questionable. They didn't put it out to bid, they didn't notify anybody, it just boom, out of nowhere, there's these training hubs. And then there's hundreds of people being hired across the state, and I get it, like, there's not a lot of senior capacity out there to mentor new people. But like, they're dumping 15 million into this training hub, you don't have any better option to do like LPHI online, virtual classes, whatnot. They're not gonna find anyone to train people.
Jim, what are you recommending?
I'm not recommending anything, I'm letting everyone know my.
Yeah. And I really like to see, I'd like to see if everyone has to be trained by one of these master trainers, I think that we have really good capacity in not just the collaborative staff, but like Tri-Town, you know, like Great Bearing, there's a lot of capacity in South County, and if we have to get one-on-one training, you know, I would love to go to one of the master trainer things if we're gonna be required to do it. But then just build our own capacity, not necessarily go to Hampton County and North Adams or whatnot. Do you know what I mean?
Is it conceivable that someone from outside of Berkshire County might be hired as, like, who's doing the hiring? Is it DPH that's hiring these master trainers? I think it is.
With a couple of things, yeah.
And, you know, as you expressed, the talent pool in the Southern Berkshires is limited. So is it a possibility for the state to hire from a different part of
The point is that it's
Massachusetts?
limited everywhere in the state.
To get someone
That's the
who's
big issue.
qualified with-
And I think that's something that DPH did not. Like, kind of struggle, you know, I'm sure they struggled with it, but they didn't really, you know.
Can I ask you a question about what the model of the training hub? So this was DPH saying we're gonna set up these training centers in the different regions, and just so if I'm understanding, is to say, this is how we're gonna help you meet the capacity, the standards, PhD standards for certification for all your local inspectors and health agents. Is that what this was supposed to do?
I think so, Scott. So they set up, they have 10 training hubs. They're gonna, DPH are gonna hire like senior trainers, handful of DPH. Minimum qualifications, like, I think it's like 8 years, gotta have an arc, and like, you gotta be fully on, ready to roll. And there's limited number of people left, like, other than dinosaurs like me across the state. A lot of these directors have gone, we've lost a significant pool of staffing post-COVID, right? And so the plan was, now there'd be all these PhD positions, there's hundreds of people being hired, brand new, not being mentored, not working for anybody. So the DPH is gonna have a certain group of qualified people that are gonna train a certain group that meet qualifications through the hubs, and they're gonna train everybody else. But the problem is, I think that model is not working across the state, and that's my opinion, because there's not enough people that even meet those master trainer qualifications. And sure, you can poach somebody, but now that, it's just, we're just playing whack-a-mole, because that's what's happened in Berkshire County. We've all lost positions, they went to the alliance, now they're gone, they're in the eastern part of the state. We're slowly diminishing capacity,
I mean,
and so.
you probably just doubled the amount of money in public health in the state. They just created it, you just doubled the number of job openings, you know, and unless we start pulling people from other states. it's
And
not
who's
enough.
gonna mentor all these new people? That's a concern, because like, we've all been there, right? We've all taken health agent jobs and we had to learn on our own. I mean, I was pretty lucky. I was mentored by a good person. But like, Rebecca trains her staff, I train my staff. I don't get millions of dollars to train my new health agent. You can't figure out a mechanism to mentor and train and do virtual trainings and all this other stuff. And plus it's public health nurse training. And so I'm concerned, because it's like, I'm just not gonna send Tri-Town employees to Berkshire Regional with someone that has no experience, so they can get trained, you know, in
So they
public
get a
health.
certificate.
Yeah, and we were advocating like, well, look at, like, I'll send two of my staff, I'll send Jane, Rebecca wants to go, Scott wants to go. Train us as master trainers, and we pay it forward and train our staff and just keep it going, keep it going, keep it going. Because the hub money ends in 3 years,
In
right? So
a
through
year and a half.
attrition, now you have new people.
Right now, it's.
Who's gonna train them? So like, you can't, there's no better model to do this. So I hope DPH, we've been advocating to DPH that this is a serious concern.
Okay, so if you want to hear what's happening on the other end, I can just say it's loud and clear. Jim, just so everybody knows, Jim has been sharing a lot of his concern with Cheryl and I, and we have gone back to Sam. They have convened a working group, so to speak. It's not formal or anything. It's just a group of folks that we deal with on a daily basis with MAHB and DPH. This is a big issue, and it kind of starts with you guys, but it really, you're the first people to really become the squeaky wheel, and they're very concerned, to the point that what we're suggesting, what MHB is suggesting, is that they stop right now, just stop wasting money, and put it out to a competitive bid to people like Partners in Health, or to some of the other public health, BME, the people that did the capacity assessment. They have some very talented people with doctorates and masters in public health who have worked in health departments before, which is something that we're seeing, that there's a lot of people at DPH that have never worked in a health department. They've never seen what goes on. They've never been on an inspection, yet they're helping you with the policies that are coming down through this program. And to be very blunt, Cheryl and I have called sort of a high alarm to DPH on that. The Berkshire County issue is the most illustrative and the easiest for us to put our fingers on, but it's happening everywhere. There's no talent pool for them to draw from to become the actual trainers. And it's what you guys have been talking about. I've been staying very quiet about it because I want to hear what everybody's feelings are, because I'm taking this back to them. And we're suggesting that they remodel this thing and bring in professionals to do the training, not train the trainer, but the people who are training the trainers should be the people who are training the actual people. And the quality of trainers is terrible, and everybody knows it. And so it's so the brakes are on, and you know, I shortcut it when I talk to Sam by saying Jim Willis, but that's good. That's a very good thing, because Jim has been so vocal about it and so right on the money, literally, no pun very much intended. He's been right on the money with what the problems are here. And I think that at this point, Sam has come to the realization that he needs to completely revamp the whole idea when it comes to the trainers.
My big picture, like my biggest concern, like, I mean, not many of us were lucky in our early stages of our career to be under someone's wing to learn the right way.
Right.
And there's a lot of people out there, but you know, all those people that have all these years of experience are gone. They got worse after COVID. And my biggest fear, 10, 20, 30 years down the pike, is like there's this new generation of public health professionals, and their foundation is lackluster. You know, you're sending people out in these communities, shutting down places, boards of health not knowing what they're doing. It's gonna be chaos if they're not trained the right way or mentored by the right people. And I get it. Like, I don't have enough time in the day to mentor everyone in Berkshire County or beyond. There's not many people like that anymore that have that practical experience. And like, you're gonna send us into the next generation of younger health agents or directors that just, they have no clue what's going on, and they have the right to be trained by the right people or mentored. And I get it, there's not a lot of people out there. They just gotta take another look at this, ask us for feedback.
Okay, it sounds like we've beaten this one enough. It is extremely important, and I'm glad, Jim, that you've taken it on so strongly and that MHB is paying attention on our behalf as well. So I think we need to finish up this meeting. It's going on 11. There's one document we haven't spoken of that looks like it's the work plan.
Oh, yeah, that's just a summary of everything that's on the big sheet.
Okay,
So if you want to just see what the actual thing is, you've got a Reader Digest version.
thank you.
You're welcome.
The flip notes,
Thank you.
Right.
or spark notes, they call them now.
Oh, okay. Yes, when I was writing my PhD thesis, my daughter wanted to know if there wasn't a cliff notes for everything.
Right.
Okay. I think we've covered the formal agenda, member updates. Anyone on the Zoom have anything they want to add? No?
She's my
I have the
guy.
VNA, obviously the VNA situation.
Right.
Very briefly, so, I mean, obviously, you have to understand what role we play, we're not a clinical, access care hospital, and so I've met with Dr. Kenny, who's my tri-town chair and serves as the medical director. He's reached out to some leadership at Fairview to get an understanding of what's out there for services, especially in South County. And we'll just try to figure out how to advocate for this. So I don't have the answers. I've met with Smitty, he's concerned, I'm getting calls, other people are getting calls. Sandusfield had a situation the other day with a member that needed services, and I don't have much to report on, but we're trying to figure that out. To see what the next steps is and how we can advocate, maybe even have a meeting with Berkshire Health Systems.
Yeah,
How
I-
temporary is this? Like, what are we thinking?
Right. I've heard that there are agencies from other counties who are trying to come in and provide services.
Good,
No.
bring Bay State in. I mean, if people need services, they need services. Like, I don't care who it is.
We have 2 points.
Please.
Did we go over leadership committee elections?
Well, we can't do it until we approve the operating thing.
Where it's gonna be on the budget it's gonna be on the agenda for next,
Okay.
yep.
Oh, speaking of flu clinics or vaccination clinics, will Jill be handling that solo? I think at some point, a couple months ago, you said you might be hiring a per diem nurse. to
We do
cover-
have Stephanie that will help out.
Is she per diem or is she full time?
No, she's per diem, but she covers me vacation, but she's available. We're meeting Monday, actually, to go over the clinic schedule.
And then we also met with Medical Reserve Corps. So once we meet with Stephanie and we have a couple of other per diem nurses that we'll reach out to, then we'll backfill. But one thing is we're really encouraging, we're telling people they need to register. It makes it so much easier on our end.
So you know who to hire
Mhm.
for how many hours.
Yep. And then also that will be heavy on our flyer. And then the other thing with the flyer is, right now it's just flu clinics, and you'll see on this sheet, it says, we're doing regular dose, high dose, and we're doing a limited amount of egg-free this year. COVID booster will be as soon as it's available. And so we have a way of emailing people ahead of the clinic once we know when the COVID vaccine's coming in, be like, so we've now opened up COVID. If you like, I think they just click their email and then they can add it right then. So to the extent that we can get as much done ahead of time, it will benefit all of us.
You have enough volunteers and stuff with that too?
Well, so we met with MRC and we're streamlining it this year. And then I've also worked with Berkshire Regional on their Get Vaccinated Berkshire. So all the information is going to be there. So I think there's going to be some key improvements this year to the flow for the volunteers and the people.
Okay, other member comments? All right. Do we have any citizens here or online? And
I'm a citizen,
this is true.
but I've been talking the entire time, so.
Yeah, no. Well, next time we have to strike that off.
That's right,
We know
strike that right
we're
on.
sorry.
Tell me to wait.
I see there are upcoming trainings listed here with links from the online agenda. You can click on them, so that's great. Anything else to comment on? The next meeting, September 8th.
And we had talked about like internally should quarterly, I think we need to figure out our articles of operation. We need to elect new, so there's some work that needs to get done. So I would,
September 8th it is.
Yeah.
Good. Motion to adjourn? I will move it.
Rebecca drew.
Bye, Brandy.
All right.
Oh,
Thank you.
Brandy's not on. Oh,
Yeah,
she is
she's
on
like
there.
message. She'll have a great
Oh, I
weekend.
didn't know she was on.
Well, she doesn't show up because she doesn't have her camera on.
Wow.
Moved and seconded to adjourn. All those in favor?
Aye.
Thank you.
Thank you, Mike.
Sorry about last
Thank
night.
you all. And don't forget to send me your contacts. Thank you.